And I appreciate the opportunity to be here and an opportunity to really take an index and the special analysis, and now we're going to really dig down and ask some fundamental questions. What does it mean? How we're going to move forward, and how do we think about this in the context of what's happening here today in the Valley? You've heard from both Russ and from Emmett, both the overall trends and also in the special analysis on the workforce. We're going to focus here on this panel particularly on the workforce challenges that Emmett laid out. And as John was mentioning, we have really an excellent panel to do that. Martha brings to us the perspective not only of being Chancellor of Foothill de Anza, but she, as many of you know, is probably involved in these issues from an education standpoint, probably more than anybody here in the Valley, looking at it from an adult training and an adult retraining standpoint. We're really so pleased that Ken Graham can join us from El Camino Hospital, because we think it's so important that we do have a private sector perspective, because we really believe that this has to be demand-driven, understanding where private needs are. And even in this recession and this restructuring, there are industries and areas where there's demand, and healthcare is one of those. And I was talking to Ken earlier, we're going to focus on that. And with Mike, you have someone that's been in the workforce area working with NOVA for so many years to understand what has been happening, going through earlier recessions and restructuring. And one point I want to make is that we've gone through restructurings before, we've gone through a recession, so how do we create that workforce system that's going to work for us over the long term? And Barbara Halsey brings not only the experience of being at the state level with the California Workforce Investment Board, but she's worked at the local level as well, working with the Workforce Investment Board. So what we want to do today is really get to the meat of two challenges that we face. One is the immediate recession, and many of those numbers were laid out in Russ's presentation. We're faced with a downturn. But the longer-term challenge of economic restructuring, which is not going to go away, we really face a very different type of environment. People switching jobs, moving from job to job. How do we help people make transitions? And that's not going to change. And many of those issues were laid out. And also the issue of replacement jobs. As people retire, where are those jobs going to come from? And then even in this environment, as I mentioned, there's going to be new industries emerging. We're going to talk about healthcare, but also, as Russ pointed out, with the green industries that we're starting to see in this economy, in areas like solar, how we're going to train people for those jobs, and what are the role of our workforce system for those as well. So what I want to do in this discussion, I want to break our part of it up into two parts. I want to talk about the problem, about the challenge, and get each one of the members of the panel to give us their perspective on what they see as the challenge that we face. And then I want to switch gears, because this is an opportunity to talk about solutions. And we've been really on the cusp of this for many years. What type of workforce system do we need in this region to move forward over the long term? And we really want to put some ideas on the table about how to design that, putting all of our heads together with community college, workforce investment boards, the private sector, and help from the state at a critical moment where the federal government is rethinking how it does training. We have an economic stimulus package coming along. The state's starting to look at some pieces. So we have a lot of pieces here. So let's start by focusing on the problem and the challenge. And I'm going to ask each one of the panelists just to give us some initial thoughts about how would you look at the challenge and how would you define the problem that we face, both in the short term and the long term. And let me start with Martha. How would you help us sort of think about this as a challenge for the region, and where do we go forward right now?
Well, I think we first have to go back to some of the data in Joint Ventures report in the index. And, some of the slides that Emmett Carson showed about the lack of preparation of a whole group of people who live in the Valley, who are prepared for lower-level, entry-level jobs. How are we going to get them trained up when we've got, a third of the students only ready for math and science and language in high school, and we've got our dropout rate and all of the things you see in the index. So on the one hand, we've got to begin to prepare the pipeline in a much more accelerated way. And that means that community colleges and our universities and our high schools and our elementary schools need to work together with business to understand that pipeline. And I'll just give two examples of healthcare and also the construction trades. We've got Neil Struthers in the audience. Neil, I'll start with construction trades. Neil has 35,000 workers in Silicon Valley in the construction trades. They work for approximately 10 to 15 years, 20 years in those trades, and they're not ready to transition to the next level of employment. So we have a whole group of people that need education, training, language skills, higher level skills, and we've got to, on the one hand, prepare that pipeline as they move along. So I think Silicon Valley needs to rethink work and education as being an integrated system where students are being educated and work at the same time throughout their lifetime and train for at least 2, maybe 3, maybe 10 careers during that trajectory. So that's one real big challenge. Another challenge is in the healthcare side. Again, we have hundreds of students who live in Silicon Valley. They already are living, God knows how they're living as young people in the Valley and older returning workers with so many of us getting laid off. But even there, the healthcare programs aren't suited to getting them trained up. So for example, in nursing, we have hundreds of students on the waiting list. We can't double or triple our nursing programs, whether it's San Jose State, Evergreen Valley College, De Anza College. We cannot double or triple our programs because you can't educate a nurse on $5,000 a year for the state. It costs $13,000. So we have partnerships with our hospitals, but this is sort of a plea to the hospital and healthcare community to partner together to help us get those students off the waiting list and get them into the careers to get them the jobs they need. One final comment, 2/3 of the nursing students are working while they're attending college. Give them those entry-level jobs in the nursing, in the hospitals, and career ladder them up. So I think stepping back, every student who is, 18 to 75, 80, we should consider work and education on a parallel but integrated trajectory.
Great, thanks. It's a good transition on the healthcare issue, and Ken and I talked before, and Ken, maybe you could tell us a bit about, from your perspective, here's an area where there has been some demand. We see the need in the area of healthcare, and maybe tell us a little about what's happening from your perspective and how we fill that need at this time.
Well, in hospitals, we have 3 major sectors of employment. We have the professional physician level, which is generally outside the hospital, and then we have nurses, allied health professionals, and support staff. Nurses make up about 1/3 of our workforce, allied health about 1/3, and support staff about 1/3, and each of them have different educational requirements and demands. 5 years ago, these answers would be different, because 5 years ago we had a tremendous problem with getting nurses. Now we are making some progress on that. We've had great support from various sources, industry and philanthropy, to actually bring education for nurses forward. The greatest need right now is in the allied health professions, particularly medical laboratory technologists. There's a 30% vacancy rate statewide. There's about 1/3 of the training in that category being produced in California. The other 2/3 are being imported from out of state. Huge problem. Then we have support staff, and that includes IT people, finance people, grounds workers, food service workers, and that kind of thing. There's a great opportunity for growth in that sector in a variety of ways. So if we talk in each category, there's different velocities going on. The stimulus package that just came out last week is going to put some significant money into IT and healthcare, particularly in the doctor's offices. There's going to be a great opportunity for people who do network distribution and office installations. This is people on the ground with their screwdrivers in their pocket putting together machinery in doctor's offices, but also the people who help people deal with adoption, because there's great resistance to the culture of using electronics in the healthcare profession, particularly in doctor's offices. I think what we're doing today is one of the most important things we can do, and I'll keep this brief, but the idea of getting the employers together with the educators is way rare. In this forum, this is very unique. It's Silicon Valley, you would think it's great, and it is, but this is unique around the United States. The misalignment between the incentives and the work rules in education and the incentive and work rules in healthcare are very dramatic. We have